When your elderly parents start to lose their balance, there are three natural strategies that everybody's body uses to prevent a fall. The first strategy is ankle strategy. So with a little loss of balance, maybe walking on uneven surfaces, our ankles are working really hard to maintain our balance. If we lose our balance bigger than that, if it's a big loss of balance, then the next strategy is our hips. And then if the balance loss is so big, then the final strategy is to take a step to try to regain our balance. In my 2 decades as a physical therapist, most of the balance issues I see are related to the ankles or the hips. And so in today's video, we're going to talk about the ankles. We'll talk about the range of motion and the strength that are needed for the everyday activities that hopefully our parents are still doing and that we want them to keep doing. And then at the end of the video, I'll show you some stretching exercises and strengthening exercises that you can have your parents do, maybe you can do with your parents. I'm Tammy Provenzel. I'm a physical therapist and a life coach for caregivers. I make videos like this because I feel like caregivers are really lacking in resources, and I'm hoping these videos can be a resource. Most of us are told as we get older, our strength decreases, our balance decreases, our speed decreases, and all those things are normal, but they don't have to be as severe as what we usually see. So the longer that we can help our parents to maintain their speed of movement, their strength, their range of motion, the longer they're going to be able to do all the things they want to keep doing, and the longer they're hopefully going to be safe. So let's talk about the ankle. The two most important motions of the ankle are dorsiflexion, so lifting the foot up, and plantar flexion, pushing the foot down. The range of motion that's available has to do with the joint itself. So sometimes arthritis can limit range of motion. It has to do with previous injuries that there might have been. It also has to do with lifestyle. If someone wore high heels for many years, sometimes their foot is a little stuck like this and they can't get as much dorsiflexion. There's a specific amount of range of motion that's needed to walk normally, to be able to go up and down stairs, to be able to walk on uneven ground. So for dorsiflexion, let's picture this as being the lower leg and the foot on the ground. This is like a 90-degree angle. We need another 20 degrees like this of dorsiflexion to be able to consistently clear the foot as we're walking, to be able to lift the foot up onto a step. And for plantar flexion, we need about 30 degrees of plantar flexion in order to push off normally while we're walking and to push up onto a step. So the range of motion is important because even if the muscles are really strong, if you don't have the range of motion, you might notice your parent shuffling their feet, or you might notice that they're not able to push off as they're walking. So their steps are really short. When it comes to the strength that's needed to be able to do all the functional things that your parent hopefully wants to keep doing and you want them to keep doing as safely as possible, we use something called the ability to hold a muscle against resistance. So if we think about dorsiflexion and you have your parent dorsiflex, can they hold it up there against resistance? My recommendation is always that we look at range of motion first, and we try to get as much range of motion as close to what they need as possible, and then strengthen within that range of motion that they have. So let's look at some of the exercises. So when we think about how much dorsiflexion your parent needs to walk safely to make sure they clear their foot, the amount of dorsiflexion that's needed is around 20 degrees. So if you look at this angle, it's almost like a 90-degree angle. We need about 20 degrees, about that, of dorsiflexion. The issue is that when you're sitting, it's easier to get that dorsiflexion. And if you think about it, when you're standing, your knees aren't bent. And so it's more accurate to actually see how much range of motion they have when they're standing. So if you have them stand at a counter and then see if they can dorsiflex, that's going to tell you if they have the range. It's also going to tell you if they have the strength to lift their foot. When it comes to plantar flexion, which is pushing your foot into the floor, For that, we need about 30 degrees to be able to push to stand up, and also when we're walking to push off. So if we look at when we're actually walking, as we step forward, we have to dorsiflex, so we hit with our heel. As we're pushing off, we need to be able to plantar flex and have the strength to carry us through our walking. If you're seeing your parent do something like scuffing as they walk, shuffling, that might be an indication that they don't either have the range of motion or the strength to clear their foot. So if you notice something like they can lift their foot, but when they get, instead of pushing off, they're kind of stuttering in their steps, that might be an indication that they don't have the push-off strength or range of motion that they need. If you're noticing either your parent doesn't have the range of motion they need at the ankle, or they don't have the strength they need at the ankle, although we want it to carry over into standing activities, starting exercises in sitting is a good way to start. When it comes to stretching, you could find something to put under this part of your parent's foot as they're sitting, and they could just sit to stretch it out. I always recommend stretching before strengthening. So get the range of motion before you strengthen. That way you're strengthening in the fullest range of motion that you can. And you're going to want to hold the stretch for 30 to 60 seconds and do that 2 or 3 times. Another great way to stretch is if you have a chair like this that doesn't have a closed back right here, you can have them bring their foot back, toes down, and then you're going to have them bring their heel down toward the floor. You can sometimes help at the knee to get a little more range of motion, and you're going to hold that again for 30 to 60 seconds. Range of motion in plantar flexion, most people maintain their ability to plantar flex, but they do often lose their strength in their plantar flexion. So after you do your stretching, then sitting exercises for the ankle will include things like just up and down. As they get stronger, you can use something to either a weight resting on the front of the foot, or you could use something like a cane and actually put some pressure as you're going up and down. When it comes to plantar flexion, you're just going to have them raise their heel up and down. And again, you can put your hand on their knee to give resistance as they get stronger. But like you now know, being able to strengthen with the knees straight is even more important when it comes to walking around. If you're noticing that your parent does appear to have an issue with their range of motion in dorsiflexion when their knee is straight, doing those exercises with their leg up on a hassock or some kind of a stool is a great way to do it. So if this is 90 degrees, you're going to want your parent to get to here. They're going to feel probably a pretty big stretch back here. Once you stretch for 30 to 60 seconds, then they can go ahead and do the exercise to pull it up. So once your parent's strong enough to be able to do these exercises in standing, you'll have them stand at a counter. So the standing exercises for dorsiflexion would be this. Standing exercises for plantar flexion would be this. You want them to try to keep their knees straight. But then the outside and the inside of the ankle also need to be strong. So this is called eversion. This is called inversion. Lots of times people have limitations in their range of motion. Big toe up and in, little toe up and out. Big toe up and in, little toe up and out. Big toe up and in, little toe up and out. Big toe up and in, little toe up and out. So hopefully today you've seen that If you help your parents to focus on their ankle, range of motion, and strength, it can really have a huge impact on their balance and hopefully decrease their fall risk. And a lot of these things can be done at home, and they can be done with your help, but it's good to have a physical therapy assessment. So you can try asking your parents' doctor for a referral to see a physical therapist, or to have a physical therapist come to the home, because then they can really look at the range of motion and the strength and give you an exercise program that's very specific to what your parent is showing as deficits. Thanks for watching today's video. Please like, share, and subscribe. And in the comment section below, let me know if you have any questions.